Welcome to the American Institute's video to introduce new and experienced coders to the unbundling modifiers 59, XE, XS, XP, and XU. Modifiers, well, they're just simply confusing, but nothing can be more complex than trying to decipher between these modifiers. First, we'll define each modifier, then discuss the difference between using Modifier 59 versus one of the X modifiers. All these modifiers are related to the National Correct Coding Initiative, better known as NCCI, and are used to unbundle services that are typically included in another, more major service. One function of the NCCI PTP edits is to prevent payment of codes that report overlapping services except in those instances where the services are separate and distinct. Modifier 59 has been flagged by Medicare and other payers as commonly used incorrectly and used just to bypass the edits to get paid when payment may not be appropriate. Documentation in the medical record must satisfy the criteria reviewed and required by any NCCI-associated modifier that is used. It's important for coders to carefully review the patient's medical record, and that's to ensure documentation supports reporting any of the modifiers used to unbundle payment. First, the X modifiers are more specific versions of Modifier 59. Never report both Modifier 59 and one of the X modifiers together on the same line item of the claim. Modifier 59 is a CPT modifier, and the X modifiers are HCPCS Level 2 modifiers created by the Centers for Medicare and Medicaid Services, or CMS. The definition clearly states that it should never be appended to an evaluation and management, or E&M, service code. Use Modifier 25 for E&M. Modifier 59 should be used only to identify clearly independent services that represent significant departures from the usual situations described by the NCCI edit. The treatment of contiguous structures in the same organ or anatomic region does not constitute treatment of different anatomic sites. Now, modifiers XE, XS, XP, XU became effective January 1st of 2015. That's a few years ago. And these modifiers were developed to provide greater reporting specificity in situations where Modifier 59 was previously reported and may be utilized in lieu of Modifier 59 whenever possible. Modifier 59 should be utilized if no other more specific modifier is appropriate. CMS published an updated fact sheet in 2021 entitled Proper Use of Modifiers 59 and the X Modifiers. Reference this information using MLN 1783722 on your Medicare Administrative Contractor website. This fact sheet provides examples of various surgical situations and how these modifiers can be applied. Before reviewing the fact sheet, complete this video, which will provide an introduction and an overview of the basics of these modifiers. Now, the XS modifier is for a separate structure when the service is distinct because it was performed on a separate organ or body structure. But isn't that what Modifier 59 is for? Use the most descriptive modifier and follow payer guidelines. When the operative note indicates the same procedures performed during the session but on a different organ or region, then use Modifier 59 or XS. The next slide gives further demonstration on this confusing topic. When can we use Modifier 59 or XS for non-surgical therapeutic or diagnostic procedures too? This applies when the service is not ordinarily performed or encountered on the same day and can't be described by any of the anatomic modifiers, such as those listed on this slide. Modifier XE is described as a service which is distinct and separate because it was performed during a separate encounter with the patient. It is only used to describe separate encounters on the same date of service. Resort to using XE when other modifiers such as 24 and 25 and the others listed on the slide simply do not apply as well to the situation. A CMS example is when you interpret and report the rhythm ECG at a different encounter than the cardiovascular stress test. If you interpret and report a rhythm ECG during the cardiovascular stress test encounter, don't report 93040 with or without modifier 59. You may report modifiers 59 or XE when you interpret and report the procedures in different encounters on the same day and same patient. Physical and occupational therapy are situations where time codes may apply when using modifier XE. If you provide two time services in time periods that are separate and distinct and aren't mingled with each other, that is, you complete one service before the next service begins, you may use modifiers 59 or XE to identify the services. Using modifiers 59 or XU properly for a diagnostic procedure which occurs after a completed therapeutic procedure only when the diagnostic procedure isn't a common, expected, or necessary follow-up to the therapeutic procedure. When a diagnostic procedure follows a surgical procedure or non-surgical therapeutic procedure, you may consider the diagnostic procedure to be a separate and distinct procedure as long as it occurs after the completion of the therapeutic procedure and isn't mingled with or otherwise mixed with services that the therapeutic intervention requires, and when it does, not constitute a service that would have otherwise been required during the therapeutic intervention. And finally, let's review Modifier XP, which could be used when a cross-provider bundling scenario applies. XP does not apply to the technical or professional bundling components related to CT and 26 modifiers, and the providers are of different specialties, and the billing office can support that the cross-provider bundling should not apply in this case. No example can be given as this is very uncommon. That's per CMS. Learn more about healthcare compliance and the American Institute, a nonprofit training organization. Visit our certification store and check out our continuing education short courses, webinars, blog articles, and other interesting items. Thank you for watching.